One.
How would you like $500 a month to put towards your rent or to use for your groceries? What if I told you this money can be yours if you meet the minimum requirements and pass a drug test? The United States government provides several programs that do just that. There are federal programs for healthcare services, programs that reduce rent requirements, and programs that offer money for groceries. Many Americans rely on this assistance to sustain themselves and their families. These benefits are available to those that meet the minimum requirements, and I'm here today to convince you that monthly drug testing should also be a mandated requirement for these federal aids. A list of federal welfare benefits are available on unitedstates.gov. There are entitlement programs and federal aid programs. Entitlement programs have no income requirements, such as Social Security, retirement, Medicare, which is a health coverage for those 65 and above, for those who are disabled, and unemployment insurance, which is not federal but state funded, and is for those that are qualified for this unemployment assistance. As you can see, the amount of unemployment that is paid in the United States, this particular map is from 2020. Another entitlement program is workers' compensation. That provides benefits for wages lost for missed work and also for medical costs due to workplace injuries or illnesses. Federal aid programs have eligibility and income requirements, such as TANF, which is Temporary Assistance for Needy Families, which is commonly referred to as welfare. SSI is Supplementary Security Income, is money for those with little to no income or resources, and or those who are disabled, and also those who are 65 and above. Medicaid is another health coverage for those with low income, pregnant mothers, again, those who are disabled or 65 and above. There's housing assistance also, sometimes referred to as Section 8, and that's a government subsidized housing agreement with rental property owners to subsidize the amount that they take for monthly rent. The renters would pay a certain percent of their income, and the government pays the rest. There's also the SNAP program. The SNAP program is Supplemental Nutrition Assistance Program, which originally started as the food stamps program, sometimes still referred to as food stamps, and it uses an EBT card. That's for electronic benefits transfer. According to the Center of Budget and Policy Priorities in their 2023 article, A Quick Guide to SNAP Eligibility and Benefits, monthly benefits for a single individual could be up to $291. A couple could receive $535. A family of three, $766. A family of four, $973. A family of five, $1,155. As the family increases, more benefits are available. Drew De Silver's 2023 article, What the Data Says About Food Stamps in the U.S., states that the SNAP program is available in all 50 states, as you can see, also in Washington, D.C., in Guam, and the Virgin Islands. In 2022, an average of 41.2 million Americans received these SNAP benefits. That's 12.5% of the United States population, making SNAP the largest federal social welfare expenditure of our U.S. government. In 2022, the SNAP program provided $119.4 billion worth of benefits, compared to the SSI benefits paid out of $58.8 billion and unemployment benefits of the same year, $33.1 billion. The 2022 Census Bureau's survey of income and program participation indicated that 62.4% of SNAP recipients had a high school diploma or less education. 61.6% reported being unemployed for the entire year despite minimum working requirements for these benefits. The World Population Review's 2024 article titled Welfare Drug Testing indicates that there are 17 states that currently require drug testing for all applicants. Each state has their own regulations And according to Laura Radell, who made an article along with Christian Joyce and Carly Wolf, their article titled Drug Testing, Welfare Recipients, Recent Proposals, and Continuing Controversies. The 5 common drugs that are tested for are marijuana, cocaine, amphetamines, methamphetamines, opiates, and phencyclidine, which is commonly referred to as PCP. Most estimates find that 5 to 10% of welfare recipients have a substance abuse problem, and this does not include alcohol abuse. Drug testing discourages drug users from participating in these welfare programs. Non-compliance could result in termination of their benefits. Positive results can also include enrollment in drug detox programs and a potential ban, temporary or permanent, from the welfare programs. Applicants denied acceptance due to a positive drug test could potentially save the state money, not providing those benefits for those individuals. Those opposed to this, such as Daryl Thompson's article, Drug Testing and Public Assistance from 2019, states that it costs money to drug test everyone that applies. Some states cover the cost directly. Some states require the applicants to pay. Some states reimburse those applicants upon a negative test result. He states in his article, positive tests have been recorded to be as low as 3.5% of all the potential applicants tested. Of all those receiving these benefits, 41,200,000, 3.5% of them would still be 1.4 million drug-using individuals accepting federal aid. Daryl Thompson also states in his article that it is considered unlawful per the Fourth Amendment, prohibiting unreasonable searches, stating that testing is deemed a search without a probable cause. Those who are applying for a job, it's common to have a drug test. Janica Ingram's 2022 article, The Worker's Guide to Pre-Employment Drug Testing, states the job offers are typically contingent on a drug test. And workplace drug tests can happen right after you get the job offer. They could happen on a random basis, and they can happen during regular intervals while you are employed. Matthew Rogers' 2023 article, Pre-Employment Drug Test, A Complete Guide, mentions the Drug-Free Workplace Act of 1988. And that act mandates drug testing for all employers receiving federal contracts and all companies receiving federal grants. The employer must take action against all employees that violate this drug-free workplace policy, up to and including termination of employment or requiring enrollment into a drug rehabilitation program before they can return to work. I've shared with you the available programs offered by the U.S. federal government, and I've noted the importance of drug screening potential applicants. When starting a new job, hopeful employees are required to pass a drug test, and the job offer is contingent on this test. Employers with federal contracts will terminate employment of any worker that fails a drug test. With that being said, a federal contract also includes the welfare programs that I have mentioned, and therefore drug testing must be mandated for all applicants of federal aid. Thank you.